I'm starting to see more and more people come in with fatigue as being the primary reason that they're coming in to see me. It used to be that it was, on the list of things they wanted to address, but not the primary reason. But I'm starting to see more fatigue cases come in. So as with so many things, fatigue is on a spectrum. It can be anywhere from, I'm just a little tired today, I could use a cup of coffee to help me out, to I am utterly exhausted and all I want to do is sit down. Like I just have no motivation. I'm so tired. And there are many possible contributing factors that can lead to fatigue. So I'm going to share 6 of them with you today. First is poor digestive function. So especially if you're tired after eating or you bruise or bleed easily, those are key signs in Chinese medicine that digestive function is probably off. So when your body can't digest and absorb the nutrients you need, you get tired. Your arms and especially your legs can feel heavy and tire easily. So if those are the kinds of symptoms that are predominant for you, then digestive function is likely contributing to your fatigue. Second is poor sleep. We'll look at behavioral issues like blue light late at night from a computer or a phone screen, because that causes an excitatory response and it interrupts your circadian rhythm and your melatonin production, and it keeps you from being able to go to sleep. Or it could be a physiological problem like anemia or dehydration. Based on whether it's difficult for you to get to sleep or to stay asleep, will give me some information about how to treat the problem. Third is low thyroid function. Now I have a separate video on this, but in general, if you're cold most of the time, have a body temperature of 97.8 or less, and have high cholesterol, your hair is brittle, falls out easily, or the outer third of the eyebrows is thinning or missing, any combination of these issues could indicate low thyroid function is contributing to your lack of energy. Number 4 is low adrenal function. So again, I have a separate video on this, but there are multiple stages to adrenal function problems. But in general, if you can't tolerate stimulation like loud noise, people arguing, or bright sunlight is really hard on your eyes, then adrenal problems are likely contributing to your lack of energy. Number 5 is anemia, or what Chinese medicine calls blood deficiency. This is what I struggled with personally after I had a really long-term, very stressful job. And then during that period of time, I also went through the C-section delivery of my son. I was very blood deficient. And for me, not only was I exhausted, but I ultimately became depressed. So that can also happen with anemia. Some of the key signs that we look for are pale nail beds, pale face and pale tongue, difficulty falling asleep, poor night vision, or even floaters in your visual field. All of those things tell us that blood deficiency is a possible contributing factor to your fatigue. And then number 6 is infection. So anytime your immune system is under stress, it can result in fatigue. Infections can be viral, bacterial, or fungal, and it can include things like sinus infection, dental infections, skin infections, cellulitis, UTIs, candida, cold and flu. And the more chronic the infection is, the more drain there is on the immune system, and the more likely it is to cause fatigue. So clearly, we'll treat each one of these situations a little differently based on the specific signs and symptoms that you're experiencing. And in some cases, we might also do some lab tests to help us further identify and clarify what the issue is. But some of the ways we might treat these situations would include behavior modification. So it might be something like a wind down routine before bedtime to, help reduce the stimulants and blue light in your eyes, things of that nature. It might also be things like reducing or cutting out stimulants like caffeine or sugar. Herbal medicines. So either herbs that would help tonify the body in cases like digestive, thyroid, or adrenal problems, or blood deficiency anemia. Or it might be formulas that help to overcome infection in cases of, viral, bacterial, or fungal infection. And of course, we'll use microcurrent acupuncture to give your body the voltage that you need so that you can heal. And it might consist of body points, ear points, scalp points. We might do some cupping or moxa, really depending upon whether we're trying to build up the body's resources or to disperse and get rid of excess. So I hope that gives you some insight into how we would address fatigue.